Welcome to the deep dive. We're here to take the information you've shared with us and, well, really get into the insights that matter.
That's right. And based on your materials, we're looking at a really fascinating and pretty rare neuropsychiatric condition today.
We're diving into Fregoli Delusion, sometimes called Fregoli syndrome.
Hmm. Fregoli delusion?
Exactly.
Hmm.
And the core of it is this really compelling belief that different people you meet are actually the same person, just, disguised.
Yeah, changing their appearance constantly. It's rare, like you said, and it's got this strange mix of recognizing someone but also completely misidentifying them at the same time.
Okay, let's unpack that a bit. It sounds inherently, well, confusing.
It is. And the name, Fregoli, it actually comes from an Italian actor, Leopoldo Fregoli.
Oh, interesting. Why him?
He was apparently famous for these incredibly quick costume changes on stage, like lightning-fast transformations.
Ah, okay. So the connection is that idea of rapid changes in appearance.
Precisely. And the condition itself was first really described back in 1927. Corbin and Fail, two psychiatrists,
And what did they observe?
they had this patient, a woman who was absolutely convinced that these actresses she saw in the theater were following her
Following her how?
by disguising themselves as people in her everyday life, her friends, people she worked with, even strangers on the street. She thought they were all these actresses in disguise.
Wow. That paints such a vivid picture of reality feeling. Well, slippery,
Yeah.
deceptive almost.
It does. It kind of brings to mind maybe that film Anomalisa.
Oh, yeah, where everyone has the same voice and face except for one person?
Yeah.
That unsettling uniformity.
Exactly. And it's a neat little connection that the writer, Charlie Kaufman, first wrote it as a play under the name Francis Fregoli.
No way.
Yeah, and a lot of the film even takes place in a hotel called the Fregoli.
That's quite a nod. Okay,
Yeah.
so let's get into the real core of this delusion.
Right. So the fundamental belief, the unshakable conviction, is that several different individuals you encounter are, in reality, just one single person.
And that person is deliberately changing their appearance.
Yes. Changing clothes, maybe hair, superficial things. But the person experiencing the delusion feels they can see through the disguise, that they know who it really is underneath.
Okay. Now, you mentioned this is a neuropsychiatric condition. It falls under a category, right?
Yeah.
Delusional misidentification syndromes, DMS.
That's the one. Yeah, DMS, Fregoli is one type within that broader group.
So how does it compare to others? Like, I've heard of Capgras delusion.
Right, capgras is probably the most well-known. That's the belief that someone close to you, a spouse, a parent, a child, has been replaced by an identical-looking imposter.
Okay, so that's about replacement. What else is in this DMS category?
Well, there's also prosopagnosia, which Oliver Sacks wrote about. That's face blindness, the inability to recognize familiar faces. So everyone looks unfamiliar.
So Capgras is familiar people seeming unfamiliar or replaced. Prosopagnosia is familiar people not being recognized at all. How does Fregoli fit?
Fregoli is almost the inverse in a way. Unfamiliar people, strangers, trigger this strong, misplaced sense of familiarity.
Ah, I see. So you see the stranger, but your brain screams, I know you. You're just pretending to be someone else.
Exactly. You misidentify the stranger as someone you do know, but who you believe is in disguise. That's the key difference from capgras, where the familiar person seems like the imposter.
Are there other types of DMS too? Seems like a strange category.
Oh, yeah. There are several others, all quite rare and unusual. Things like inner metamorphosis, the belief that people can physically transform into other people,
Wow.
or reduplicative paramnesia, believing a place or location has been duplicated and exists in two places at once.
Okay, that's really bending reality.
It is. And then there's Cotard syndrome, the belief that one is dead or doesn't exist or is putrefying. And others like subjective doubles, believing you have a doppelganger running around. So Fregoli sits within this spectrum of really profound disturbances in identifying people, places, or even oneself.
And you mentioned earlier, this often comes with a sense of being targeted, like paranoia.
Yeah, very often, yes. The belief isn't usually neutral. The person often feels that the single individual in disguise is persecuting them, following them, maybe has malicious intent.
Which must be incredibly frightening and isolating.
Absolutely. It causes significant distress and anxiety.
So what's potentially going on in the brain to cause such a specific, unusual belief? Where do neuroscience and psychology kind of meet on this?
Well, neurologically, researchers have found a few potential links. One interesting connection is with dopamine levels.
Dopamine. How so?
Sometimes patients taking levodopa or L-dopa for Parkinson's disease over long periods can develop symptoms resembling Fregoli. L-dopa increases dopamine in the brain.
So too much dopamine might play a role.
It's one hypothesis, yeah. Another major area of focus is brain injury or lesions in specific areas.
Which areas?
Damage often seems to involve the right hemisphere. Specifically, areas like the right frontal lobe and the left temporoparietal regions have been implicated. Also, the right temporal lobe and, interestingly, the fusiform gyrus.
Hang on, the fusiform gyrus, isn't that the fusiform face area? The part crucial for recognizing faces.
Exactly. Which seems paradoxical, right? You'd think damage there might cause prosopagnosia, the inability to recognize faces.
Yeah. So how could damage there lead to over-recognizing or misidentifying strangers as familiar?
That's the puzzle. One thought is that maybe the damage doesn't just switch off recognition, but disrupts the whole process in a complex way. Instead of the normal, is this face familiar, check going wrong and resulting in unfamiliarity, prosopagnosia, or a feeling of wrongness, capgras, maybe in Fregoli, it goes wrong in a way that triggers a false sense of familiarity, a kind of hyper-recognition but misapplied.
Okay, wow. And you mentioned the right side of the brain seems more involved.
Research, including some meta-analyses, does suggest that right-sided brain lesions are more common in Fregoli, particularly when it's secondary psychosis.
What's secondary psychosis?
That means the psychosis, like the Fregoli delusion, seems to be caused by another underlying medical condition, like a stroke, brain injury, or maybe that Parkinson's medication we mentioned. This is contrasted with primary psychosis, like in schizophrenia, where the delusion seems to arise more from the psychiatric illness itself.
Got it. So right hemisphere damage seems key, especially in those secondary cases, and the frontal lobe, too.
Yes, the frontal lobe, particularly the right frontal lobe, often comes up. This area is crucial for executive functions, things like reasoning, judgment, monitoring our own thoughts and beliefs, attention. Damage there could impair someone's ability to evaluate and dismiss the bizarre belief.
How does the brain usually handle visual information, just basically?
Well, very simplified, there are sort of two main visual pathways. One stream going up towards the parietal lobe. The dorsal stream is about where things are in space, guiding actions. The other, going down towards the temporal lobe, the ventral stream, is about what things are, identifying objects, faces.
So Fregoli seems like a problem in the what pathway?
It appears so, yeah. Disruptions in that ventral stream, which includes the fusiform face area, seem critical for these delusional misidentification syndromes. It's about processing the identity and familiarity of what you're seeing.
We also read something about P300, an electrical signal in the brain.
Yes, the P300 event-related potential. It's a brainwave measured with EEG, and it's thought to reflect aspects of attention and working memory, updating basically how your brain registers and processes significant new information.
And it's abnormal in DMS.
Studies have found differences. Often, the P300 response might be smaller or slower in individuals with DMS, particularly linked to activity in the right hemisphere.
What might that mean?
Well, it could suggest difficulties in correctly tagging new faces or information as new or familiar, problems integrating the perceptual information with existing memories and knowledge about people. This might tie back to that right hemisphere dysfunction we talked about, which is also involved in things like insight and understanding context. And some studies link this to reduced gray matter in the right frontal areas involved in attention.
Okay, so there are definite neurological correlates being investigated. What about the psychological angle? Is it just brain damage, or is there more to it?
It's rarely just one thing. Psychological factors are almost certainly involved too. How someone processes emotions, their coping mechanisms for stress or trauma, these can play a role.
Could trauma trigger something like this?
Trauma is sometimes suggested as a potential factor, maybe not a direct cause, but perhaps influencing how delusions form or manifest. It could be a kind of distorted coping mechanism in a way. What else? Things like social isolation could potentially contribute. Maybe a deep-seated, perhaps unconscious desire for connection or intimacy gets twisted into this belief of being constantly pursued by one familiar person.
So a psychological need finding a very unusual expression.
Possibly. And then there's the role of imagination and narrative. People tend to create stories to make sense of their experiences, even very strange ones. Cognitive biases or specific ways someone filters information and perceives the world could also reinforce the delusion once it starts.
So it's this complex interplay, potentially, between brain function, emotional state, past experiences, And cognitive style.
Exactly. It's usually seen as a biopsychosocial phenomenon.
Okay, so how does this actually, look in a person's life? What are the key symptoms or clinical signs?
Well, the core is that hyperrecognition or intense feeling of familiarity towards strangers we discussed. There's this belief in the fluidity of the persecutor's appearance. They're shape-shifting, essentially. There's often a strong emotional connection, though usually negative, like fear or anger, towards this perceived individual. And interestingly, despite the delusion, the person might have quite detailed personal stories or narratives explaining why this is happening.
So there's an internal logic to it, even if it seems bizarre from the outside.
Often, yes. They might also be hypervigilant, paying incredibly close attention to people's appearances, looking for clues to confirm their beliefs.
That sounds exhausting and must make social interaction incredibly difficult.
Immensely so. It often leads to social withdrawal, strained relationships with family and friends who don't share the belief, and significant anxiety in public places.
So how does a clinician arrive at a diagnosis of Fregoli delusion?
It involves a really thorough psychological evaluation. The first step is usually ruling out other conditions that could cause similar symptoms, things like schizophrenia, other psychotic disorders, substance use, or other neurological conditions.
Checking for those brain injuries or maybe medication side effects you mentioned earlier.
Yeah, exactly. Looking into any history of trauma is important too. Fregoli is often a diagnosis made when other explanations don't quite fit, and this specific persistent belief about one person in multiple disguises is the central feature.
So it's partly a process of elimination, combined with identifying that very specific delusional theme.
Right. It requires careful listening to the person's experiences, recognizing the pattern. It's crucial to be sensitive, explore their narrative without being dismissive, assess their cognitive functions, both deficits and strengths, and consider all the potential contributing factors, neurobiological and psychological.
Okay. Once it is diagnosed, what happens next? What about treatment or ways to cope?
Well, the first thing to say is there's no known cure as such. Treatment focuses on managing the symptoms, reducing the distress caused by the delusion, and improving the person's quality of life.
And how is that typically done? Medication.
Pharmacotherapy is usually the first line of treatment. Antipsychotic medications are the most common choice to try and lessen the intensity of the delusional belief.
Do other meds get used?
Sometimes, yeah. Depending on the individual case and any co-occurring symptoms, anticonvulsants or antidepressants might be added.
And what about talking therapies? Can they help with a delusion like this?
Yes, psychotherapy is really important. Cognitive behavioral therapy, or CBT, is often used.
How does CBT help with a fixed belief, like a delusion?
It doesn't necessarily aim to completely eliminate the belief overnight, which can be very difficult, but it can help the person examine the evidence for and against their belief, develop coping strategies for the distress it causes, challenge some of the thinking patterns that maintain it, and manage associated anxiety or paranoia. It's about working with the person to reduce the impact of the delusion on their life.
Okay, that makes sense. What about other forms of support?
Support groups can be incredibly valuable. Connecting with others who have similar, maybe not identical, but related unusual experiences can really reduce feelings of isolation and stigma. Sharing coping strategies can be helpful too.
Are there things individuals can do themselves day to day to cope better?
Definitely. Education is key. Understanding the condition can itself be empowering. Staying connected with a support system, whether it's family, friends, therapists, or support groups, is vital.
And general self-care.
Absolutely crucial. Things like regular exercise, trying to maintain a balanced diet, getting enough sleep, and practicing relaxation techniques or mindfulness can all help manage stress and improve overall well-being, which can indirectly lessen the impact of the symptoms.
It sounds like a really multifaceted approach is needed.
It really is. Some more innovative approaches also focus heavily on building a strong therapeutic relationship. Trust is key. Helping the person reframe their narrative in a more empowering way, using creative expression like art or writing as an outlet, mindfulness training to increase cognitive flexibility.
So helping them step back from the belief a bit.
Kind of, yeah. And also things like social skills training, support for integration into the community, cognitive remediation if there are specific thinking deficits, and always focusing on the person's strengths. It's holistic.
It's interesting how this condition, despite being so rare, pops up in culture sometimes. We mentioned Anomalisa. Are there other examples?
Yeah, it seems to capture something maybe about identity or perception that resonates. Richard Powers' novel, The Echo Maker, touches on themes of misidentification related to Capgras, but it explores similar territory.
Right, that sense of not knowing who people are.
Exactly. The TV show Mr. Robot, though mainly about other issues like D-Die, certainly plays with unreliable perception and questions of identity. It's appeared in theater, apparently. The BBC show Doctors had a Fregoli storyline once.
Any other?
Well, fun fact, there's a character in The Sopranos named Russ Fregoli, an anagram.
Yeah.
And more recently, Alex Garland's film Men had the protagonist seeing all the men in a village with the same face, which has strong, Fregoli-like echoes. And apparently the upcoming horror sequel Smile 2 has a character named Louis Fregoli, connecting to the idea of entities wearing faces like masks from the first film.
So it definitely taps into some sort of
Hmm.
maybe unease about faces, identity, knowing who to trust.
It seems like it. And research is still ongoing, of course. It's tricky because Fregoli often co-occurs with other disorders, making it hard to isolate specific mechanisms. There's still a lot we don't know about the precise brain processes.
What's the current focus in research?
One area is comparing Fregoli when it's part of a primary psychosis like schizophrenia versus when it's secondary to something else, like a brain injury.
And are they finding differences?
Yes. That meta-analysis we mentioned found that secondary cases are more likely to be older people. It might be their first psychotic episode, and they're more likely to have visible abnormalities on brain scans, often those right-sided lesions.
Whereas primary psychosis cases,
They seem more strongly linked with persecutory features, that feeling of being targeted. And interestingly, misidentifying family members specifically seemed more common in the secondary cases.
that's fascinating. So the same label, Fregoli, might actually cover slightly different underlying processes depending on the context.
It certainly looks that way. It highlights the need for really careful assessment.
And despite all these challenges,
Hmm.
the confusion, the fear, the social difficulties, people cope. Your sources mentioned resilience.
Absolutely. It's important to remember the human capacity to adapt. The materials pointed to examples, maybe not all formally diagnosed Fregoli, but people with unique or altered perceptions who've channeled these experiences into incredible creativity.
In what kinds of fields?
All sorts. Art, writing, music, even science and technology, dance, fashion, philosophy, activism. It's presented as a testament to how individuals can navigate even profoundly different perceptual worlds and find meaning and purpose.
That's actually quite inspiring. A
Yeah.
powerful reminder of resilience.
It really is.
Okay, so wrapping up our deep dive today, Fregoli Delusion, it's this rare, uh, really intriguing condition, the core belief. Different people are actually one person in disguise.
Yeah, and we've seen it seems to have roots in both neurological factors, possibly involving the right hemisphere and facial recognition pathways, and psychological aspects like emotional processing and narrative construction.
Diagnosis is complex. Treatment focuses on managing symptoms and improving quality of life through medication, therapy, and support. But it definitely highlights just how complex and sometimes fragile our brain's grasp on identity and reality can be.
Absolutely, and it really underscores how vital it is to seek professional help if you or someone you know might be experiencing beliefs like these. Support is out there, and it can make a real difference.
So maybe the final thought to leave you with is this. Think about how much your own sense of who people are shapes your entire reality. What does it mean when that fundamental perception gets skewed, as in Fregoli?
It's a deep question about the nature of self, other, and the reality we construct. Definitely food for thought in exploring neuropsychology further.
Indeed, a fascinating glimpse into the workings and sometimes misworkings of the mind.
A complex picture, and we're still learning.
Thank you for joining us for this deep dive. We'll explore another topic next time.